Hello and welcome to In Good Shape. Coming up, mini strokes, why they're dangerous. Bed bugs, why they're gaining ground. And fascia, what is it and why is it so important? And here's your host, Dr. Carsten Lekotat.
Sometimes I see patients in my practice who complain about lower back pain or knee pain, and it's very hard to make a specific diagnosis. So I think maybe it's the fascia who's causing the problems, that connective tissue between our muscles and our internal organs. So today I'm going to talk about fascia with Hubert Ritter, who is doing Rolfing therapy here in the heart of Berlin. Welcome to In Good Shape.
Rolfing gives you good posture and stress-free movement.
As a GP, I often tell my patients, just wait and see. Time will heal your problems. But sometimes the problems just won't go away. Your back still hurts, there's still tension in your neck, and if you take a look into the mirror, you see that your posture is crooked. So maybe you should try out Rolfing then.
The fascia form a near-transparent network under our skin. These sheets and strands of connective tissue surround muscles and organs and act as a passageway for lymph and nerve endings. When they're in good condition, they have an ordered structure. They support the body and keep it in balance. The targeted stimulation of the fascia can sometimes restore mobility, but treatments can be very painful. For a long time, there was no scientific evidence for the benefits of fascial therapy. But a project by a team of physicians and biologists at the University Hospital in Ulm has now attracted international attention. The researchers have analyzed thousands of tissue samples to study what's known as fascial adhesion. Take shoulder pain, for example. For a long time, no one could have imagined that such painful symptoms could be caused by fascia sticking together.
This collagenous fibrous tissue is literally growing, expanding, trying to stiffen something.
Some alternative medical practitioners use cupping to treat back pain and stiffness, which they attribute to fascial adhesion. The effectiveness of this therapy is not established, and it requires more study. In recent years, one treatment that's gained in popularity is Rolfing. It involves the targeted and deep massage of a painful area. The aim is to loosen the adhesions so the fascia can be better supplied with nutrients. Research in this area is still in its infancy, so there's plenty yet to discover about the fascinating world of fascia.
I'm here with Hubert Ritter in Berlin, and he treats patients with Rolfing, and he has written a book about it. Thanks for having me today.
Thank you too.
Fascia are parts of the connective tissue. Why are they so important?
Fascia wrap and connect everything, all structures in the human body, every muscle, every organ has a fascial wrapping, and the fascia gives our body its shape and supports it. So they're very important to give the body support. At the same time, they're elastic and act as shock absorbers. They're also responsible for making organs and muscle glide on each other. And at the same time, they're highly innervated with nerve endings, so they also form a communications network in the body.
And you say that those fascia can stick together and can get some kind of glued. Yeah, so why is that a problem?
It's a problem because wherever fascia becomes stuck and glued, there is a lack of motion, of movement, and where there's no movement, there's pain.
And why do they get glued in the first place?
Fascia get glued or hardened whenever there's a lack of movement or when they are under constant stress.
And with Rolfing, you can loosen them up again?
Yes, with our hands, we loosen the restrictions in the fascia, but we don't just loosen them, we also move the fascia in the direction of more alignment so that the entire body becomes better organized and better aligned.
And what kind of symptoms can you treat with Rolfing?
Rolfing can help with all kinds of problems in the locomotor system, as back pain, neck, shoulder, knee pain, but it can also be used preventively. A body that has resilient fascia and is well aligned will be less susceptible to injury and pain.
Okay. We will witness a Rolfing session in just a moment, but first I will show you 2 patients where fascia therapy has really been helpful.
Anna Bornert has had back pain since she was a teenager. Doctors couldn't pinpoint the cause, and at times the pain has been excruciating.
When I was pregnant 2 years ago, it flared up badly again.
Lothar Lehmann also has problems with pain. His knees hurt after every little exertion, particularly troublesome for a keen hiker and dancer. He relied on pain relief gel and wasn't given much hope by his doctor.
He said the cartilage in my knee was basically worn out, that it can't be cured, and I'll have to live with it. My doctor wasn't quite that blunt, but that was his general message.
Rolfing therapist Katrin Grobelnick believes Lothar Lehmann's main problem is not osteoarthritis, but the fascia in his back.
I took a look and noticed that his back and spine seem very tight. His thoracic spine is very immobile, and he slumps into his rib cage. He spends a lot of time sitting at a desk. And then I looked at his pelvis and the angle at which it's tilted. All these things affect our knees, of course.
Fascia are especially likely to be the source of back problems. This connective tissue can thicken and harden, and that hurts. The fascial layers contain small nerve endings that extend like the branches of a tree and relay pain. That also seems to be at the root of Anna Bornert's back pain. She's getting a special massage from her physiotherapist.
There are adhesions and tightness. The fascia's grid structure, that is normally formed of parallel fiber bundles, undergoes a change. They can shorten, tighten, or get knotted.
For Lothar Lehmann, his physiotherapist believes Rolfing treatment will help to loosen the tight fascia around his muscles. Over time, that should make his chest and pelvic area more flexible again and help relieve the extra strain that he was placing on his knees. After 10 treatment sessions, Lothar Lehmann's back is feeling better and his knees are much improved.
The pharmaceutical industry has lost one of its best customers. I don't need the pain relief gel anymore. I still have arthritis, but it doesn't hurt anymore.
Anna Bornert's back has also improved as a result of the fascia therapy.
I work a lot with small children and I pick them up a lot, and my back suffers. Each time I come here, I notice afterwards that it feels better.
By doing her exercises at home, Anna Bornert can keep her fascia soft and flexible.
So we just saw a patient with knee problems, and then he had his fascia treated and the knee problems went away. But how can this happen? Because the cartilage hasn't grown back. Now we will see a patient with neck problems. And before we do any therapy, we have to do some diagnosis. So we start with the gait analysis.
Rolfing treatment always starts with a structural analysis. That means we look at the patient in walking and try to see where has the fascia shortened and thickened. So please just walk back and forth here a couple of times. The first thing I notice is that the hips are shifted forward slightly and the upper body is leaning back a little bit. That leads to a shortening in the chest And the head and neck are being pulled forward and down a little bit.
But her problems are located here in the back here and in the neck, and you say that they arise from a shortage here in the front pain.
Exactly, that's what typically happens, is that the shortness is on one side and the other side needs to compensate. That means there's additional tension there to hold on to the neck, and that's where the overload occurs and the pain starts to happen.
Okay, and now you can start therapy.
Yes.
Okay, that's what we do.
The first thing I'm going to do here is try to reposition the hips. So I bring the knee up and use pressure of my shoulder to push through the thigh into the hip and make the hip go back a little bit.
So can you actually feel the fascia beneath your hands?
I can feel it through the skin.
Okay.
I can feel places where it's stuck or where it's hardened or where it's glued together. Okay. And I try to release those places, but not just to release them, but also reposition the fascia.
Is it painful?
We try to respect the pain threshold of the patient. It's very important, because if there's too much pain, then the organism will recoil and will not open up, and we will not create more length, but the body will shorten and tighten. So it's very important to take that into account and respect the limits of the individual person.
So right now you're focusing on the posture and you're treating the right leg, but still there's some pain in the neck. So do you treat in this region as well?
We always treat the entire body. So after having repositioned the hip a little bit, I'm going to go up to the chest.
Okay.
I place my hand under the back here to support and lift up the chest a little bit. And with the other hand, I can now lengthen the fascia on the front of the thorax.
Okay. We got a lot of viewer questions, like from Tonir Banerjee from India. He has some pain in his shoulders for about 9 years, ever since he had an accident. And now he wants to know if treating the fascia could help him.
As a result of injuries, fascia typically hardens and thickens and becomes glued together. And this can develop into a vicious cycle, so that stiffness can itself produce pain. And by releasing the fascia, we can sometimes break that cycle, because we introduce movement and adequate range of motion. Right. And then sometimes we can improve the situation even after years.
And as patient, can I do the therapy by myself? Say, like pressing on the fascias or using a fascia roll, for instance?
It's hard to do it on yourself with your hands, because often places are hard to reach. But you can use a fascia roll, which is an excellent tool for self-help. It's just important to respect your limits and not overdo it. So don't go beyond the pain threshold.
Right. So I leave you to all the rest of the therapy, like treating all the focal points as well. Well, this is a holistic therapy. And you know what also a holistic therapy is? Writing. Like writing your questions by email.
On one of our upcoming shows, we'll be talking about smartphone addiction. We're hooked on our mobile telephones and social media day and night, but what's that doing to our health? Send your questions to ingoodshape@dw.com. Just write smartphone addiction in the subject line. We look forward to hearing from you.
The dreaded stroke has an evil little sister, and her initials are TIA, which stands for transient ischemic attack. The symptoms are quite similar to a real stroke, and as you can't distinguish between a real stroke and a TIA, you should take immediate action, TIA, and call an ambulance.
Impaired speech. Numbness in one arm. In some cases, blindness in one eye, Then a few moments later, everything seems okay again. It's a relief, but you're not out of the woods yet.
Unfortunately, these things are often not taken seriously because they go away again.
The biggest danger is that you'll suffer lasting damage the next time the blood flow gets blocked. Then the symptoms won't go away.
For Ortwin Klose, it came out of nowhere. He's physically fit and active. He likes to travel and does lots of gardening.
I was in the garden watering my cucumbers, and then I noticed that my body was unsteady, and I keeled over like a tree falling. My hand banged against the clothesline. Thank God my neighbor heard it.
Herr Klose, what's wrong?
Then I noticed I was able to move my right leg, but on the left side I couldn't even wiggle my big toe.
One-sided paralysis, just like a stroke. But during his time in the ambulance, his mobility returned.
The ambulance brought Mr. Klose to the hospital. Upon arrival, we were told that the patient's movement had returned partially during the ride over. All we noticed was a slight weakness in the facial muscles on the left side.
Such neurological malfunctions are the result of circulatory disorders. A stroke occurs when an artery that carries blood to the brain gets blocked, meaning that certain parts of the brain are no longer being supplied with oxygen. If the clot dissolves again rapidly, the brain can function again. What Ortwin Klose experienced is known as a transient ischemic attack, or TIA. The doctors discovered a constriction in the posterior cerebral artery. This is where the blood clot formed. Ortwin Klose was prescribed anticoagulant tablets to prevent blood clot formation. He stayed in hospital for 8 days, and everything seemed to be fine again. But right after he was released, he got a shock.
I noticed my left side getting paralyzed again. The symptoms had come back. The doctor gave me a checkup and immediately called the ambulance.
Paralysis, followed by another collapse. Could it have been a real stroke this time? But once again, on the way to the hospital, the symptoms disappeared, as if nothing had happened. Despite the medication, a clot had formed.
There's always the danger of it happening again. But it's a very rare coincidence that it happened so soon after he'd been released from hospital.
Lack of oxygen in the brain affects people differently. Oliver Gröne had trouble with his vision.
The vision in my right eye got darker and darker, and after a certain time I lost my vision altogether. It only lasted about 10 seconds before it brightened up again. I thought it was a one-off. I had an appointment at the ophthalmologist 2 days later, so I thought I'd just ask then.
The eye doctor identified the threat of a stroke. Oliver Gröne was immediately sent to the hospital. It was an emergency situation. There, the doctors determined the cause. An ultrasound scan showed a narrowing of the carotid artery. A blood clot had formed there.
A blood clot can enter the brain, but it can also go into this branch vessel that leads to the eye, and from there into the artery that services the eye, and block it. Then the retina stops working, and the patient is blinded.
The danger for Oliver Gröne was that it could happen again. The next time, the effects could be long-term. To guard against that, the doctors placed a stent in his carotid artery. It keeps the artery open and lowers the risk of new blood clots forming. Luckily, the mini-stroke caused no lasting damage, but it was a very clear warning sign.
It could have been much worse. If I hadn't had that appointment, I probably wouldn't have gone to the doctor.
Temporary circulatory problems are usually harmless. They're seldom as drastic as in Ortwin Klose's case, These days, he's feeling much better.
In the beginning, I felt rather nervous because I kept on asking myself if it was going to recur. But now I feel like I'm having fun again. I'm back to dancing with my wife on Sundays and taking my dog for a walk every day.
Just thinking about bedbugs makes me feel itchy. Those blood-sucking beasts leave rashes all around the body. And the problem is, if you've got bedbugs at home, it's very hard to get rid of them.
Probably the worst kind of holiday souvenir, bedbugs. They stow away in your luggage or clothing. Then take up residence in your bedroom and in other rooms too. They're hard to ward off and even harder to beat. They're becoming increasingly resistant to insecticides.
Since the late 1990s, we've seen a huge increase in bedbug infestations worldwide.
Exterminators confirm the critters are making a comeback.
We used to get maybe 1 or 2 homes a year to deal with. Now we see 1 or 2 a week, sometimes more.
At the German Environmental Agency in Berlin, researchers are observing the spread of bedbugs across Europe with concern. They're trying to figure out why the parasites are such a growing problem. Arlette van der Paan has studied bedbugs gathered from homes in Berlin. She's been able to confirm that some bedbugs have indeed grown resistant to common insecticides.
The United States and Australia have some extremely resistant strains. It's not quite as bad in Germany yet, but we do have resistant strains too. For exterminators, that's a problem. Their goal is to kill all of them.
Bedbugs are mostly nocturnal. During the day, they tend to hide out in cracks and crevices. At night, they come out to feed.
I was in Italy with a group of people, and we'd all been bitten by something. At first, we didn't really pay that much attention to it and assumed they were mosquito bites. But the unusual thing is that the bites were all in a row, so I should have realized.
When Julia got home, she put her suitcase on her bed to unpack. The parasites escaped and infested her apartment. All it takes is one pregnant bug. A single female can lay up to 300 eggs in her lifetime. Often, an infestation isn't noticed until the bugs start biting.
Not everyone reacts to bites the same way. For some, the symptoms can appear immediately, or they can take days or even a week to appear. And some people don't react at all.
One of the telltale signs is that the bites are often grouped together. They can cause raised red welts that itch terribly for days. But apart from the bites, bedbugs are harmless.
So far, they don't transmit diseases. You can infect them in the lab, but that's it. We haven't seen any cases where they transmit diseases in a normal setting.
Once a home is infested, only an exterminator can help. It takes a pro to know where to look for the bedbugs.
You basically have to take a room apart. Anything they could hide in or under. Behind picture frames and baseboards and curtain rods, under lamps. You also need to look under the bed frame. Anything that's under the bed or near the bed. Dark crevices, corners, edges, peeling wallpaper. Those are all places where bedbugs like to hide.
Treatment can involve special insecticides, heat or cold, and every single hideout needs to be dealt with. But it's rare for a single treatment to kill all the bedbugs.
Usually we have to do between 2 and 4 treatments before the problem is completely dealt with.
That's in part because of the rise of resistance to the chemicals. Researchers are now trying to develop a rapid test that pest control professionals can use on-site to determine which insecticides will be effective. Some exterminators also use heat treatment. Exposing bedbugs to temperatures of at least 55 degrees Celsius for a certain amount of time will kill the bugs and their eggs. Nowadays, there are heat tents. They're big enough for a suitcase, sofa cushion, or bedding. Another option is freezing, but the temperature has to be very cold and sustained for a long time. After traveling, it's a good idea to unpack your bag and shake everything out in the bathtub. Then wash as much as possible at 60 degrees Celsius. Whatever method you use, to beat bed bugs you have to kill them all, or the whole thing will start all over again.
You can find more information about health and fitness on our Facebook page. So see you next week, and until then, let's all try to stay in good shape.